The FDA updates the label on Johnson & Johnson's COVID vaccine to warn about an increased risk of a rare neurological condition. So here to answer your questions is Dr. Todd Ellerin. He's the Chief of Infectious Diseases at South Shore Health. It's great to see you, Doctor, as always. So we've been talking about this now for a couple of days. The condition is called Guillain-Barré. It's a syndrome. So what does the data show about the link?
Well, Guillain-Barré syndrome is a very rare neurologic disorder. It affects about 1 in 100,000 people in the United States or around the world. And it looks like after the J&J vaccine, it's about 1 in 120,000 people. So it doesn't seem like the risk is that much more than the expected background risk. But, the FDA, the CDC, they're concerned. So they did add a warning to the label saying there may be a rare risk in patients within the first 6 weeks of getting this vaccine. It is important, of course, for providers to know that there may be an association so we can get onto treatment, the diagnosis quickly, et cetera.
And quickly, did the patients recover, and did they have anything in common, something that the doctors are looking at other than getting the vaccine that perhaps triggered this?
The majority of the patients were over 50, Maria, and most were men. We don't know exactly the outcomes. It sounds like only about one person died. 95 out of the 100 sounded like they were serious and hospitalized. I can only say that most people with Guillain-Barré syndrome do recover over time, although it is serious and you can have lasting disabilities from it.
Well, Dr. T, this single-dose vaccine has had some challenges. As you know, early this year, regulators investigated reports that it caused a rare blood clotting disorder in women. Is it unusual for a vaccine or for any medicine to cause such serious side effects for a small number of people?
Rare things occur rarely, Ed, and that's true. Even with the Guillain-Barré syndrome, some of the other adult vaccines have warnings in their label that there could be rare cases of this. Certainly, the benefits far outweigh the risks. And the one thing I want to remind you guys is that there have been cases of Guillain-Barré associated with COVID-19 in and of itself. And in Massachusetts, the risk of dying from COVID-19 has been about 1 in 400 when you think of the 18,000 deaths in Massachusetts. So when you think of something that has a risk of about 1 in 120,000, the benefits of this vaccine far outweighs the risks, in my opinion.
Okay, so based on that, we know that vaccines are now available to anyone who wants one, the age limits, but more than 30% of Massachusetts residents still have not decided to receive a shot. So what do you say to them still in July? What do you want them to know about the decision they're making in your medical opinion?
Well, what I want to say, Maria, is that the Delta variant is spreading. We know there are other variants that are lurking on the horizon. And the fact of the matter is when you look at the states that have the least vaccination, they have the most number of cases. So this is really, in some ways, a prophecy as to what's going to happen in the future with the people who are unvaccinated. We know that you're running the risk of becoming an individual Delta factory, not only infecting yourself and leading to those, whatever happens, but also transmitting to other people. So the best thing you can do is get vaccinated.
Dr. T, great to see you. Thank you.
Good to see you, Doctor.
See you guys.
Be well.
Take care.